The urinary incontinence means the leakage of urine which is without the knowledge of a person. When a person feels that he or she has to go to washroom, but before they reach washroom, they leak some drops or even more amount of urine involuntarily, that is called urge incontinence. The stress incontinence is when a person is tightening the abdominal muscles like coughing, sneezing, laughing, and there is an involuntary leakage of urine, that is called stress incontinence. Particularly in elderly females, there are so many anatomic structural changes going on which will lead to decreasing the muscle power of the pelvic floor where the continence stays. Means that the bladder, urinary bladder goes down, the urethral angle is changed, the vaginal vault is displaced by the displaced urinary bladder and urethra. This makes the inherent structure into disproportion. So when in normal condition this is a tight situation like a tight hammock which goes down and gives way. In this situation, when elderly female is having coughing or sneezing, the urine will automatically leak. They cannot control it. So this is called elderly movement having stress urinary incontinence. For female urinary incontinence, which is most of the time stress incontinence in elderly females, there are mainly two types of management. One is medical, another is surgical. In medical management, we tell them to tighten the pelvic floor, which is called pelvic floor exercise or biofeedback. By that, they will tighten their pelvic floor, which will increase the tone of the muscles, which will hold the urine without incontinence. The second part in medical management is oral medicine, which will decrease the powerful bladder contraction. So they main part will control the incontinence. In the other aspect, the surgical aspect, there are so many options available in the world. We can do it with minimally invasive surgery in that we can put a mesh, it's just like a net of a material just outside the bladder and the urethra to support that muscular part, because after putting this mesh, the local fibrosis and local support will make stress incontinence go away. If it is a real major anatomic defect, we may have to do open or laparoscopic surgery to prevent this stress urinary incontinence.